I am here with Irene E. Harris, who's the RN and at the Health Center Clinical Manager at Pearson? Picard. Oh, girl, I don't know that name. And Sheena Smoot, who is at the Health Center of Clinical Manager at Blackburn. So welcome to the show. Really exciting and great things you're doing for the community this Saturday. Let's talk about it.
Yes. So we have our upcoming health fairs. We have one for the west side of Indianapolis and the east side. The first one will be on actually this Saturday, on the 2nd from 10 to 2 at our West 38th Street location, and that's 5515 West 38th Street. We offer a variety of different things that we're going to be doing there, anywhere between lots of health information. Obviously, we have free blood pressure screenings. We're also going to do some dental screenings. We have like adolescent information there as well. So just a wide range of population, so the whole population.
I don't think people maybe, oh, there you guys are out there in the community. You know, I don't think people realize when you say free blood pressure screening, you talk about dental and you think they're like, oh, that's not that big of a deal. These are some of the first things that can indicate that there are larger problems going on. So you getting this for free and then maybe, hey, oh, I have some other things going on, and maybe that can help people get the treatment that they need or realize that something else is kind of going on. Yeah, for sure. You know, you guys do a lot. Eskenazi Health does a lot of things in the community. Why get out? Because, I mean, hospital system kind of makes money by people coming in. Why go out and give out free services and get in the community?
Well, you know, it is important for us to be part of the community and, you know, just bringing people to us. They may not know what services we're offering. You know, a lot of people don't visit a hospital unless they're sick or needing something or need to go to the emergency room. But Eskenazi is more than just an emergency room or a hospital. You know, we are out there to prevent, you know, illness. And with the blood pressure screen, if we do one and it's abnormal, there's a nurse there that can tell you, hey, let's get you in to see a doctor, because it is important. Prevention, you know, is key to staying healthy.
And early intervention, because you're thinking, I'm just gonna, as a kid, you know, we all play with that blood pressure cuff at the pharmacy, but it really is a great indicator of it, finding out if some things are going on or not. But this is also kind of coinciding, and next week is the first week of August. It's the National Health Center Week too.
Yes. Correct. Yep. And we have we have like over 16 health centers that we have within primary care to give service as well. So, and even when you're there, like she was saying, if you get your blood pressure screening, we have a nurse. We can get you, possibly if you're not a patient of ours, we can get you in so you can find your doctor. We have financial counselors also to help with that insurance piece, so that way people can understand.
Just avoid medical care because of medical cost, and that could cost you something way more valuable than just a couple dollars if your life is extremely valuable. You're kind of with people though from literally the time they take their first breath. You have OBGYN services all the way up until end of life care too.
Yes.
Yep. And in, you know, during Health Center Week, we highlight, you know, the work that is done out, you know, in the health centers. Once again, because, you know, since the beginning of life, there's care that needs to be given, right? You need vaccines, you need checkups, and you know, we are there. You have a partner in your health with us. You know, you have your provider, your nurses, and your MAs. But there's also a lot of services, kind of like what Sheena was already saying. You know, we have financial counselors to help you through those decisions of what insurances are out there and what you can qualify for. We also have social workers and you know, nutritionists and just different people that work in our health centers that really live for this kind of work. You know, this is their passion, and so we like to partner with our community to keep them healthy.
Absolutely. This is not a thing you get into if you don't care about people. So you really care about people. So make sure you get out there, get out to this health fair, find out important information, find out what's available to you before you just say no in your brain, and, you know, get the health care that's so vitally important. All the information will be on our website, Life.Style.Live.TV. Thank you so much for being here, and I hope you have a great event on Saturday. All right, we'll be right back. Yeah, of course.